How did you first realize something was wrong?
Well, I first realized I had something more in my testicle. I felt something down there. Thought a hernia or something with torsion when it twists. So I went to the ER. They said it's probably just a hernia. I'm not worried about it unless it gets bigger or larger. So I just thought hernia. Over the next almost a year, as the tumor grew, I realized it's not. It's not a hernia. I need to get it checked out. So I went to an urgent care. And the funny thing is, when the doctor was feeling down, he had me lay down and felt it's basically is in my stomach and lower pelvic area. He's like, "Are you making muscles?" I'm in my 50s. I don't have muscles like that anymore. So, no, it's not a hernia. You need to go to find a surgeon. So I found a surgeon who was great, but he doesn't do this type of surgery. He made sure I'd find the right surgeon who is an oncology specialist, an oncology surgeon, Dr. Kaplan, who's been amazing, and that's where we move forward from there.
So, what went through your mind when you were diagnosed with differentiated liposarcoma, which is a rare and aggressive sarcoma?
Um, the more I learned about it, the more it was a bit scary because that's the thing. Sarcoma is very rare, as I said. It's 1% of all cancers, and there's 100 subtypes. And my subtype in the retroperitoneal, I can never say that right, my lower area in pelvic region, is 10 to 15% of that 1%. So it's very rare. More research needs to be done, and that's the scary part. Is right now we need more information. So it's not like someone says I have colon cancer, or I have, like my brother had thyroid cancer, my mom had colon cancer, and other people get that. It's not attached to an organ. It attaches to soft tissue and fat. So it's differently, and you usually don't know about it. Like with mine, I didn't know about it until it just kept growing and it was pressing into my organs, and that's when it was painful. So when we had my first CT of my chest and MRI of my lower area, I was able to see how big it is. It's almost like I had a basketball in me, a baby. It ended up being an 8.5 pound tumor that they took out of me.
Wow.
It was a 12-hour surgery. We thought 8 to 10 was 12 hours. Amazing surgeons, amazing team. But yeah, when we found out how big it was and how intensive the surgery, it was pretty scary. And the more I learned about the disease, the more I realized everybody, including doctors, even the doctor that misdiagnosed me initially, not blaming him, but more information needs to get out there so people know what to look for and diagnose it so we can get treated earlier in the process, because you really don't know about it until it gets too big and starts pressing into organs and painful.
So, you've talked about what the sarcoma was and how big it was and all of this, but the question was, what went through your mind? How did you feel?
Well, there's a lot of cancer in my family.
Mm-hmm.
So after my brother had thyroid cancer about 3 years ago, I was like, yeah, I'm probably next because it just runs in the family. Didn't know I'd get the bonus of a super rare one. So I like to use humor a bit, but you know, what really hit me is, we'll talk about later, is when it's come back. But the initial was, okay, I got cancer. Okay, I have great surgeons, specialists. I'm in New York, so, I get top in the field out here. And I was confident in surgery. I was confident in the procedures. I couldn't live with it anymore. So that's what really is going on. It's just, my friend said I was gray before. I didn't have, my life force was being sucked out of me.
Right.
As I say later, it took a devil out of me, and that's what I felt. I had like this living creature sucking the life out of me.
Before this experience, had you ever heard of a sarcoma?
Never. Never really heard of it. And people don't know about it. It's so rare.
So you've undergone the surgery, you're doing chemo. It's the AIM chemo. What has that treatment journey been like so far?
Let me back up. So before I did the surgery, they offered me a stress to study that was going to do 3 rounds of AIM chemo before. I didn't feel I could handle the chemo before. 3 months, basically. It's a 21-day cycle, 4 days in a row, and then 17 days to recover, times 3. Before the surgery, I could handle it. After the surgery, they offered the same thing, but the results and everything looked good from the pathology. I wanted to get my life moving forward, and that's what we all felt was a good thing. Do close surveillance and just get MRIs every 3 months and a CT scan of my problem is in my first scan after 3 months, cancer came back. So then they offered me, since the cancer came back, to do chemo, but a little different. And I appreciated this. Is we're just going to do one round and then do another scan. Problem is, after the one round, cancer doubled in size. So now it's the size of a tennis ball. So since I took about a month to do the chemo, getting me scheduled and everything, we're doing another round. Hopefully it makes a difference, and then we have surgery planned next month.
So what's it like sitting here and going through the chemo? What's this journey like, coming here and doing that?
The chemo itself, luckily, the results haven't been, the side effects haven't been bad. The nurses and the treatment, really no problem, just a lot of pain, because they do a great job of, they do a great job of hydration. So it's 2 hours of hydration before we start, and pre-meds and mesna to help. Then we do the Red Devil, which is looks red, and it's in a syringe, and they give me that over 5 minutes. Then I do 4 hours of the other chemo, the main one, can't pronounce it with an I. Then we do 2 hours of hydration again, and then more, I think, mesna as well. Then I do mesna pills. Then 4 hours later at home, or 6 hours later, like usually around 10 p.m., more pills, mesna. That's more of it helps with the cancer. That's the M. A is what they call this drug, but it's the Red Devil. I is the other one, starts with an I. And treatment itself, luckily, my side effects, I've had hiccups, which is weird, not odd. I've had some tongue sores.
You're weird and odd. It makes sense.
I am weird and odd. It does make sense. And at the end of the last month, the treatment, my hair, I shaved it, but I'm starting to lose hair and going bald in places, but in a beard. That's why I got the hat. But overall, it hasn't been, knock on wood, so bad. I did say the second round, which I'm doing now, can be worse, so we'll see what next week is like. But overall, been great. I get dessert after every treatment, so that's good.
There's that. What complications or surprises have you encountered, like your neutropenia, hospitalization, or post-surgical recovery?
Okay, so what happened last week, about a week or so after chemo, I had some chest pain, and I've had a previous heart attack, so it's concerning. It felt different, but I had some chest pain. So I did go to the hospital. They thought it might have been an infection of kind, but what I had was low white blood cells. Something I didn't mention, at the end, the 4th day of chemo, they put this thing on. It's a box, I forgot what it's called, and it gives me a shot 27 hours later. Super cool, so I don't have to come in to get that shot. It gives me an automatic shot with the little robots about 27 hours later to help build up the white blood cell count. But I think that didn't kick in, and after a few days in the hospital, that kicked in, and my white blood cells came back up, and I was fine. But, being in the hospital is no fun. I have a great treatment again. They did everything they can, loads of antibiotics, but that's what it ended up being, so we're aware. But I've had my appetite. I'm overall fine. I will say it here, weed helps. Okay, morning before I do my chemo, gets the day started. At night, helps with, keep the energy going, helps with sleeping, helps with anti-nausea, helps with appetite. So we'll put that out there.
You shared your story in a very creative and openly.
Yes.
You've shared your story in a very creative and open way. What motivated you to share about all of this?
So my sort of vlogging I'm doing. Well, I found out years ago when I had my heart attack, and I posted about it, and I posted links to how you can help yourself. I saved 2 people's lives. I helped by having one person went and got tested, and one person knew the signs from my post. So I found that people want to hear the story, want to do that, and it can help others. I'm a dog trainer. I'm not able to do a lot of my dog training things right now, and so I've got used to being on camera from doing that. And I'm mostly on Facebook. I've shared a lot, and then when I was in the hospital, my journey, and people have said it helps them. And I show mostly the good, not the crying and the anger. But I feel it really. People reach out to me. People that are in the hospital right now. People that want to follow my journey. So if I can, and that's why I'm doing this, can help others with awareness, with this is how I'm fighting it, and with some humor I try to have, it can help others. And it's also, for me, just opening myself up to other people, and their response is helping me keep motivated too, with the comments and likes, and it helps because it's a lonely journey.
You've used humor, AI, visual storytelling to talk about cancer. What role has creativity played in your healing or advocacy? I mean, it's a little bit similar than the but expand on that.
Yeah, well, I used to be an art director in advertising, and I'm learning more about AI, and I like making videos. So I'm having fun with that. Again, it's getting my creative juices out there in a positive manner to spread the word and help people relate. With editing videos and making fun and being creative. I did a video where I sent my tumor to hell that I did in the hospital. That was fun. And now I made one showing the size of it as a tennis ball, and I took a still and was able to animate that with fire. And just using my creativity and keeping focused on that takes my focus away from the negativity, the bad that's happening to me, the stages of grief, the anger, the sadness. The more I focus on work and creativity and editing videos, I'm not focusing on the negative.
Right. I was going to say, don't you feel like also in this time where you're kind of like waiting to see what is going to happen to your life, keeping yourself busy, keeping yourself creative, do you feel like that is super helpful on keeping you motivated?
Well, outlets, whatever you have. For me, I can't really do my dog training job right now, but I'm working on doing more my advertising type stuff. So I'm focusing on building another business. I'm focused on helping my friend design her website, design a logo for a friend, and it just keeps my mind active. So if you can do things when I have my dog, we go on long walks and get out of the house.
Does it keep you focused on positive movement forward?
Yes, everything's about moving forward.
Right.
And try not to look too much into the negative. One thing that's really helped, I have to say, is ChatGPT. I take the doctor's clinical notes, I put them in there, I take the MRI notes, the pathology. It helps me understand what's going on. In fact, it's a big help. I never really used ChatGPT much, but I'm using it now, and I don't take it as what the doctor didn't say or that. I just take it to understand better what's going on with me in between going to the doctor. Like I got my MRI results and I didn't see a doctor for a week. So I had a month to sort of understand what's going on sometimes from results and help me absorb it rather than the initial shock when you go in, cancer's back, cancer grown. I have some time to digest things, and then I obviously take everything from the medical oncologist or the surgeon, but I will say ChatGPT has been a great help in understanding things.
What's something people misunderstand about sarcoma rare cancers?
Yeah, great question. Well, I didn't know. I've been watching a lot of YouTube videos of actually doctors explaining things that have helped me. And Facebook groups. So the main thing I've learned is how rare it is, how it gets misdiagnosed with me and other people. Not necessarily the fault of the doctors, but it's just not as known. Again, it's 1%. It's been termed the bad luck cancer. because of the 1%, but I've seen people talk about, doctors call it because it's like the orphan cancer, like it doesn't get funding enough and people don't know about it, and bad luck as, yeah, you get cancer, but now you get one that it's so rare that you don't have as much knowledge of how to help you with it. So I'm trying chemo, see if that works. If not, we might try other things. But right now, the only thing that they know works for my type, my location, is just cutting it out and doing surgery. But with my cancer coming back so far, 3 months after, if it comes back again and again in these short terms, it's hard to keep going and doing surgery in the same area. So that's my main concern.
How has living with a rare and recurring cancer changed your day-to-day life?
My day-to-day life, well, I haven't been able to work. I'm a dog trainer, and being compromised, and while I'm healing from surgery, being compromised, it's very careful working with dogs, and I do work with dogs with behavior issues. But even puppies have sharp puppy teeth, and getting a puppy teeth little on the hand and then the saliva is very dangerous for me. So that's the main issue, really, is I like my job, I like working, and I've had to pivot and look what else I can do to earn a living, which I'm going back to advertising and doing some stuff I can do in front of a desk instead of going to people's homes and working dogs. Maybe try to do a little bit of both. So the work has been the biggest part.
How has cancer changed your sense of identity as a man, trainer, artist, patient?
It's I'm a cancer survivor now. I'm a cancer patient now. Yeah, I got this now. That's something, I've always been known for having good hair. Now I don't. I'm going away. It'll come back, I hope. But I'm just trying to keep, moving forward. That's really it. It is part of my identity now. That's why I'm switching from my videos with dog training and doing this, because awareness needs to happen. I'm fine being in front of a camera, and if I can do my part in helping people, one, get diagnosed correctly and understanding what they have. A lot of the sarcomas do end up on extremities different than mine, and people just think it's a lipoma or something. And you gotta push the doctors. You gotta push to get the right diagnosis, and go to a Sarcoma Center, go to a specialist. If you're not in New York, go to one that's near you. You want to go to someone that understands. And that's what I've learned, is that maybe that's why I got this type of cancers, so I can help spread awareness. Sadly, maybe.
What's one thing you wish doctors or the public better understood about sarcoma patients?
Well, I don't think we're different than patients, but we're a little more confused because I'm like, is it lung? What's the name of it? They go to the liposarcoma, retroperitoneal. What's that? I learned that just means where it is. Because it doesn't attach to an organ, it's confusing. Because when I tell somebody I have a sarcoma, they're like, yeah, but what body part? And there is no body part. It engulfs around them. So that's the biggest thing with explaining it to people, that it's different than other cancers. So the awareness is, it's not lung, it's not prostate, it's not in blood like lymphoma. So it's not as known.
What does hope mean to you now?
I'm trying to keep hope. Trying to keep positive. Just hoping after the surgery it doesn't come back. If it comes back again after my next 3-month scan, that's when hope is fading for me. But we'll see. Hopefully we get some good results. That's where my mark gets to after surgery. If it comes back in the next 3-month scan, hope it's going to be hard. We'll see. We'll try. I got good support.
What can others do to better support people with sarcoma?
Well, support is checking in, phone call, a text. They're in the hospital and chemo, coming to visit helps. Asking how they're doing. What you should stop doing, what everybody should stop doing, is offering solutions. I saw this video of ivermectin. I saw this person that solved their mom's cancer, but no one else's. Just stop. People tell me, oh, eat apple seeds because they have cyanide and can also kill the cancer. Stop. You can say, hey, I know a great holistic doctor, I know a good surgeon, but just because you saw a video on Instagram or TikTok, this guy that's pushing it and these people, it doesn't mean it's right. You want to help, show something that has clinical studies behind it. Show something that you could say, hey, I tried some supplements, but all angles coming at us of everything that worked for somebody else with some other cancer. It's not this cancer. Are there any results to this cancer? If you offer advice for somebody, do you have clinical results for this type of cancer? If you don't, just offer support. I'm here for you. I mean, just meet them for lunch. Just show that they have someone to talk to, there's someone to be there. It's a lonely process, especially for someone like me. It's just me and my dog.
Record videos for them.
Record videos for them and come see them and just be a good friend. And here's the other thing. I find a lot of people like, well, come to me and come do this. Go to them. Don't ask them to come to you. There's a lot. What I post online, I post a positive. I'm crying in this one, but I usually don't. I post a positive, post a fun. But there's a lot of darkness. There's a lot of crying. There's a lot of yelling. There's a lot of anger. So, don't. A lot of what you see online from a lot of people, they're not posting this. There's a lot of that.
And that's okay.
And that's okay. It's okay not to be okay.
Okay. Last question. What message would you share with someone newly diagnosed with a rare sarcoma?
Well, like I said before, go to a specialist. Go to people that know your disease. Secondly, it's not as scary as it sounds. Get a good surgeon. My surgeon is badass, that you trust, medical oncologist that listen to you and will work with you. But the process itself, honestly, that's why I've made a lot of my videos. It's not as scary. I got a chemo port. I'm getting chemo right now. See? Scary. It's fine. Okay? And share. Share with friends. I posted on Facebook, and it's helping others, and it'll help you, because getting the feedback from me helps too. So be open and honest with your family and friends, and they'll be there for you. I think that's important.
All right.
Okay.